Hello, my name is Nevin Akaydın. I am with Santa Clara City Library. Thank you for joining our Medicare Basics webinar. I am with Zara Rothenberg today, and we have been providing these talks with Zara for years now. And thank you, Zara, for your time today, for being with us.
You're welcome. Okay, hi everybody. My name is Zara Rothenberg. I am an independent broker. I am licensed by the state of California, and I'm certified by multiple insurance companies. So today we're going to talk about introduction to Medicare, Medicare Basics. My screen, am I in control of the screen? Because I cannot.
You have the control of the screen, but if you want to.
Let me flip the page.
If you can stop sharing and start sharing again, so it might work.
Okay.
Yes, we have a question about how do we get a link to the recording. Again, this session is being recorded and I'll be email you all attendees with the link. It will be posted on library's YouTube channel.
Yeah, it doesn't let me go to, let me close this. No, I cannot go to the next page. I don't have the control.
Okay, let me try to share my screen then. Would it work for you,
Okay.
Zara?
Sure.
Okay. Can you stop your sharing? Okay. I have the presentation. Let me.
Okay. Earlier, it was working for some reason.
Yeah, with the technology, it always happens.
Yeah.
Let's see. Do you see my screen?
Yes.
Okay.
Okay, we can go to the next slide, the topics. Thank you. Okay, the topics we're going to cover today are, we talk about the original Medicare eligibility. This is when you become eligible for Medicare. And then we talk about your choices when it comes to Medicare. Then we talk about Medicare Part A, B, and C. Briefly, we talk about Medigap, which is Medicare supplement. And then we talk about prescription drug. With the prescription drug, we talk about different tiers of drug and also different stages of drug. Then we talk about extra help with prescription drug. This tells you some people may qualify to get help with their prescription drug. So we talk about the threshold. And finally, we would have a Q&A at the end. Also, throughout the presentation, I'm going to pause and I'm going to ask if you have put any questions in the Q&A. And Evan has been nice enough to read the questions so I can answer them. Now, if your question is this general questions, please go ahead and put it in the Q&A and I would answer it throughout the presentation. If your question is really specific to you, please wait until the end of the presentation. I'll make sure we have enough time to address it. And so that way we can finish the whole presentation on a timely manner. Okay, next slide. Okay, Medicare eligibility. When you turn 65, if you have worked for 40 quarters, which is equivalent to 10 years, and you have paid your Social Security and Medicare taxes, you are entitled to your Medicare Part A and you're eligible for Medicare Part B. In some cases, if you have had the disability then you also, even if you're younger than 65, you qualify for Medicare. You have to be a US citizen or a US resident for at least 5 consecutive years and lived in US. Now, there are different eligibility periods. The first one is initial enrollment period. Initial enrollment period could be, it is when you just turning 65 or when you are applying for your Medicare Part A and B for the very first time. So in that case, you have 7 months to sign up for Medicare. You have the month of your birthday, you have 3 months before the month of your birthday, and 3 months after the month of your birthday. So it's a total of 7 months that you can sign up for Medicare. So for example, let's say if your birthday is on July 15, you would have time from April 1st through October 31st, that's 7 months, that you can apply for Medicare. We got out of presentation, Nevin. Can everybody see the? Okay, so thank you. In this period, again, you have 7 months to sign up for your Medicare. If you happen to apply in the 3 months before the month of your birthday, let's say in our example, if you apply in April, May, and June, the effective date for your plan for starts would be July 1st. If you happen to apply in July, August, September, or October, then the effective date would be the first of the following month. So these eligibility, they all apply to the Medicare Advantage, which is Part C, and prescription drug. So these are the plans that are subject to these eligibility periods. The next election period is the green one. The green one starts from October 15 through December 7th. So this is for those who are already on our Medicare and they want to change the company or they want to change the plan they're with. So at this window of opportunity, they can change their plan every year. And then the effective date for the new plan would be January 1st of the following year. And the next election period would be the open enrollment, the light blue. The open enrollment is from January 1st through March 31st. And this is for those who are already on a Medicare Advantage. They want to disenroll from the Medicare Advantage and sign up to another Medicare Advantage. And then finally is the special enrollment period. The special enrollment period could be any time during the year, but you need to have a qualifying event. So you need to qualify in order to apply under special enrollment. The qualifying events are if you retire, so in the middle of the year, you decide to retire, therefore you can sign up under a special enrollment to Medicare. If you move out of the service area, because with the Advantage plan, you always have a service area, which is the county in which you reside. So if you move from that county and go to another county, you would have a special enrollment to sign up into a different plan, which is available in the new county. If you receive assistance from a state, like you are on Medi-Cal or SSI, you qualify for a special enrollment. Also, if you have some chronic health condition, you qualify for a special enrollment. And finally, If you are getting assistance with your prescription drug under the extra help plan, then you qualify for special enrollment. So I'm going to stop now and see if there's any questions, Devin.
So there is no question right now.
Okay, we move on. If somebody has a question regarding this, you can also ask later.
Okay, next slide.
Yes. Okay, this is where for your options when you come to Medicare. Again, when you turn 65, if you have paid your Social Security and Medicare taxes for at least 10 years, you are eligible, you're entitled to Part A, and you're eligible for Part B. Now, Medicare consists of Part A and Part B. Part A is for inpatient hospital. That means you have to get admitted to the hospital. Part A has 0 premium. Premium is what you pay every month for your plan. So Part A also covers 100% of the cost of your hospitalization. However, it has a large deductible. Part B, on the other hand, it covers outpatient hospital. That means if you go and have a surgery at the hospital in the morning and they send you home at night, that would be considered outpatient. It would cover your doctor visits. It would cover any kind of a lab work. The Part B has a small premium and it only covers 80%. And it has a small deductible. Now, I'm going to give you these amounts later on the future slides. So I'll give you the exact the deductible amounts and your premium. So when you apply for your Medicare, Part A and B combined, they are referred to as original Medicare. So when you apply for original Medicare, you get your Medicare card, which is on the right, and some people refer to it as red, white, and blue card. On your Medicare card, you would see your name, your Medicare number, and effective date for your Part A and Part B. If you apply for your Part A and B at the same time, obviously the effective date would be the same date. But if you apply it at a different time, these two effective dates would be different. Now, please note that the effective date always starts on the 1st of the month, regardless of what day is your birthday. So this would be your Medicare card. Now, because Medicare Part A and B does not cover everything, Part B only covers 80%, Part A has a large deductible, and combined, they do not cover prescription drug. Most people, after they get their Medicare card, they go to private insurance company to apply for additional insurance to get a complete coverage. When it comes to going to private insurance, then that would be step 2. You really have 2 options. Option 1 is you apply for what's called a Medicare supplement plan. This is also known as Medigap. So if you apply for Medigap, the Medigap fills in the 20% that Medicare does not cover under Part B, and it also covers the deductible under Part A. And there are several Medigap plans depending on the company you apply. And depending on the plan you sign up for, you may have a small copay or a small deductible. But a supplement plan does not give you prescription drug. So if you choose option 1, in addition to supplement, you have to go and sign up for a prescription drug plan, a standalone prescription drug. So you would get your drugs covered. So in the case of option one, you would carry 3 cards with you at all times. You would carry your Medicare card, you would carry your supplement card, and you would carry your prescription drug card. Now, option two, some years ago, Medicare did not want to get involved with the administrative work and processing the claims. They made arrangements with private insurance companies, and they said, for every individual who is part of Medicare, the Medicare pays certain amount of money to the insurance company, and the insurance company would take care of all your medical issues and claims. Now, you still have all the benefits you had under A and B. You don't lose that, but that all the benefits are embedded in this new plan, which is called Medicare Advantage, or is referred to as Part C. So when you come to Part C, generally, most Part C plans, they offer you prescription drug. So you don't have to go and sign up for a standalone prescription drug. And some give you additional benefits. So now there are advantages and disadvantages on each of these options. The advantage of the supplement is flexibility. The supplement plan allows you to go to any doctors, any hospitals, anywhere in the whole US, as long as they accept Medicare. So let me repeat that, as long as they accept Medicare, because not every doctor or every hospital accepts Medicare. So you need to ask them, do you accept Medicare? So this is a good advantage because it really gives you flexibility. If your doctors are scattered all over area, you can keep the same doctors as long as they all accept Medicare, and your plan would cover them. The disadvantage of the supplement plan is, first of all, it starts at a higher price because obviously, because of they give you the flexibility, is a more expensive plan. And not only that, every year on the month of your birthday, your premium increases. So not only you get an increase because of cost of living, you also get an increase because you're a year older on your birthday. So once you get to your late 70s and 80s, your premium could be a considerable amount of money. And the other disadvantage is, since it does not give you prescription drug, you have to pay another premium to get a prescription drug plan. When you come to the Advantage plan, the Part C, the disadvantage of this plan is it could be an HMO or a PPO. Whether it's an HMO or PPO, you belong to a network. So you have to go to your network doctors and the hospitals. In the case of PPO, they allow you to go out of the network if you choose, but you may have to pay a higher price. The advantage of the plan is, first of all, it's cheaper. Secondly, the premium is whether you're 65 or 95 is the same price. So it doesn't go up by your age. And the other advantage of the plan is it offers you prescription drug. So you don't have to pay a separate premium for your drugs. In addition to that, depending on the plan and on the county where you live, it gives you other benefits, such as it may give you certain number of transportation to your doctor or pharmacy. It may give you an allowance for over-the-counter or gym membership. It may give you certain, benefits that's on top of what you get. Now, the good thing is with the Advantage plan, there are some plans, depending on which county you live, that may have as low premium as 0 premium. So basically you get all these benefits at 0 premium. Again, you have every benefit you had under A and B is embedded here. But with this plan, you would have a copay or possibly a deductible, depending on the plan you sign up. So once you get it, you have to see what coverage you get and what is your deductible. So Nevin, I'm going to stop here and see if there's any questions.
Yes, there are 3 questions.
Okay.
If you sign up for Part A on turning 65, are you barred from participating in employer-sponsored HSA?
Okay, the HSA is a special plan that is basically for lower income people, and there are some plans that once you sign up for HSA, you would pay overall possibly less than what you would pay if you didn't have HSA. Now, as far as employer plan, when you turn 65, if you are still working and your employer offers you what they call creditable insurance, which is at least as good as what Medicare offers, so you're not obligated to go and get Part A and Part B. You can stay under your employer plan for as long as you want. Now, some people, because A does not have a premium and it doesn't cost you anything, some people, when they turn 65, they go and get their Part A, but since they're working, they wait and do not get their Part B. In that case, you get your Part B when you retire. Okay?
Thank you. Another question. Can you de-enroll from Part A after signing up?
Yes, you can disenroll. You can call Medicare and just disenroll, but generally you wouldn't want to do that because A is not costing you anything. Why would you want to disenroll? But at any time, if you want to disenroll a plan, let's say you want to go back to a different country and you know you're not coming back to US, you may want to just disenroll from your Medicare.
Thank you. If you enroll in regular Part B, not Advantage plan, through Blue Cross, are you limited to local network or can travel anywhere in the country and be covered?
Okay, Blue Cross has both supplement plan option 1 and also option 2 Advantage plan. So it all depends which plan in Blue Cross you choose. If you go to option 1 Blue Cross, obviously you can travel anywhere in the whole US and you are covered as long as you go to a doctor or hospital that accept Medicare. But if you choose an Advantage plan within Blue Cross, then you have to stay in the county where you reside. So you cannot pick and choose and jump to the other counties. So it's important if when you come to a point that you want to sign up for a plan, always talk to your brokers. I generally meet with all my clients and explain to them for their situation which plan is better for them so that they can make a decision.
Thank you. 2 more questions. If reach 65 has been resident for the last 5 years, but don't have 40 quarters met, still eligible for Medicare?
You are eligible for Medicare if you have worked. Generally, Part A is not going to cost you anything, but if you have not worked for 40 quarters, you have to pay for your Part A. So you need to talk to me and then I can tell you exactly how much you have to pay for your Part A. And depending how much you're short, let's say if you have worked 35 quarters, then your premium would be a little bit lower than if you have worked less than 30 quarters.
Thank you. Last question, is there a maximum amount Medicare will cover in a lifetime?
Yes. Yes, there is a maximum. I'm going to cover that in the future slides.
Okay, let's go back to presentation. There's one more question, but it's really with detail and specific to that person, I guess. Maybe if we have time at the end of the presentation, we can answer that question.
Okay, sure.
Okay.
So we go to the next slide.
Okay.
So now I'm going to give you some amounts and give you more detail on what is Part A and what is Part B. Now, Part A, as I mentioned, it's for inpatient hospital. When you turn 65, you qualify for Medicare, and you could be under 65, but on the basis of disability, you may qualify for Medicare. If you have end-stage renal disease, which is if you are on kidney dialysis, you qualify for Medicare. Also, the ALS qualifies for Medicare. You have to be a US citizen or a legal resident who has lived in US for 5 consecutive years. Next slide. Okay, now these are your deductible. Remember I told you I'm going to give you the amounts. So when you go to the hospital, if you stay in the hospital anywhere from 1 day up to 60 days, so for the first 60 days, you have a deductible of $1,556. So this is a deductible, regardless of whether you spend 1 night or whether you spend 59 nights, this would be your deductible. If you stay there over 60 days, then you would pay $389 per day for day 61 through 90. So for the next 30 days, you have to have a copay. You pay $389. Now, in addition to this, you get 60-day lifetime of coverage. The lifetime coverage means you could use 3 of these days in 1 year and 2 days in another year. So in the lifetime, you give you another 60 days, and that would be at the rate of $778. Now, this rate changes every year. It goes up every year, but this is for 2022. So Part A is they also cover you for skilled nursing. You get 20 days of skilled nursing at 0 premium. But if you stay there anywhere from 21 to 100 days, you would have to pay $194.50. It covers home health care at 0 copay, and it covers hospice. Now, this is only Part A, Medicare. Once you go to option 1 and option 2, those plans pretty much come and cover these deductibles and this premium that you have to pay. So they may have a little bit of deductible or copay, but for the most part, these large amounts are covered. That's why after you get your A and B, you always want to go and apply and get additional insurance from private insurance company. Next slide, please. Okay, now we're going to go to Part B. Part B, as I mentioned, it only covers 80%. And there is a premium for Part B, a base premium of $170.10. This is for 2022. If you collect Social Security, your premium is automatically deducted from your Social Security. But if you have decided not to collect Social Security yet, then they bill you, you have to pay for the $170.10. There is a small deductible of $233 for Part B. Now, this premium is a base premium. If it happens that your income is higher than in the case of if your individual adjusted gross income on your tax return. If you file your taxes as a single individual person, if your adjusted gross income is below 91,000, and if you're filing joint, if your joint income is below 182,000, then you pay the base pay of $170.10. But if your income is higher than those base thresholds, then Medicare comes to you and asks you to pay more. And how much more would depends how much more you made. And so it's important to know and not be surprised, because a lot of people, after they sign up for Medicare, all of a sudden they realize instead of $170, they have to pay a larger amount. So Part B, if you're eligible for Part B, and if you don't have any other creditable insurance through your employer or your spouse's employer, and you decide not to go and get Part B because you say, well, I'm healthy, I never go and see a doctor, why do I want to pay, sorry about that. You may say, why do I want to go and pay a premium when I get sick, then I'll go and apply. Well, it doesn't work that way. If you don't have a creditable insurance and you're over 65 and you do not apply for Part B, there is a 10% penalty increase on your premium for every 12 months that you are late for the rest of your life. It's not just the year that you were late or a few months that you were late. That penalty would be applied to you for the rest of your life. The reason they did that was they want to make sure if you don't have any other insurance, you're going to apply for Part B, whether you're healthy or not. Next slide. Okay, now we're moving to Part C, which is the Advantage. In order to get Part C, you have to have Medicare Part A and B, and you have to live in the planned service area. Planned service area is usually the county where the plan is being offered and the county where you reside. So as long as you live in the county and you have your A and B, you qualify for a Part C. There is no pre-existing condition. You're guaranteed you get in. Next slide. Okay, Medigap. Medigap, as I mentioned, is offered by private insurance company. With Medigap, you also have to have your Part A and B. Once you get your Part A and B, you can apply for Medigap. They give you 6 months after you get your Part B to sign up for a supplement plan. Once you sign up, within 6 months of your Part B, you have a guarantee issue that they accept you. So there is no pre-existing condition. But later on, if you want to change your plan, depending on your situation, they may ask for a pre-existing condition. This plan allows you to go to any doctor, any hospital, anywhere in the whole US, as long as they accept Medicare. The premium increases by your age, and it does not cover prescription drug. Next. Okay, now we're going to go to prescription drug. With the prescription drug, prescription drug is offered by Medicare-approved private insurance companies, and many of them help you to lower your costs. So when you sign up, the insurance company would help you with the cost of your drugs, and also it guarantees the future increases for the rest of the year. The premium varies on the plan, depending which county you live and which plan you choose, your premium could vary. And also it could have a deductible from $0 to $480 in 2022. So then again, I know these are a lot of numbers I'm throwing at you, but it's very important to, if you're getting ready to sign up, talk to somebody who is expert so they can help you and find out what your situation is, find a plan that's suitable for you. Next. Okay, just like, remember we said Part B had a 10% penalty. Okay, Part D also has a penalty. If for 63 consecutive days, you do not have any prescription drug coverage and you do not have any creditable insurance, then you're subject to 1% per month penalty. This time they go by month. So if you're 6 months late, then that would be 6%. If you are 12 months late, it would be 12%. And that penalty is applied for the rest of your life. So again, some people, when they may say, well, I'm not even taking any prescription. Why do I need to go and sign up for a prescription drug plan? But then once they decide to go and sign up, then they may be subject to a penalty. Next. Okay, now drugs have different tiers. Now what I'm going to show you is really an example. That doesn't mean these are the prices for your drugs. This is just an example. So drugs are classified into 5. Some companies have 6 different classification. They call it tiers. So tier 1 and tier 2 are generic drugs. Tier 3 and tier 4 are brand drugs. And tier 5 is a specialty, very expensive, like chemotherapy drugs. So if you have a prescription drug plan, whether you have it through the standalone prescription drug or whether you have it through your Advantage plan, which gives you prescription drug. So we have to look up your drugs and see what tier they are. So let's say, for example, if you have a tier 1 drug, let's say the cost of the drug is $50. But in your case, since you have a prescription drug plan, you only pay $1. So your copay is only $1 and the insurance company pays $49. So you get help here. Let's say for tier 2, if the drug is $90 and your copay is $3, insurance company pays $87, and so on and so forth. So basically, once you have the drug plan, the insurance company helps you with the cost of your drug, depending what tier your drugs are. If it happens they don't cover your drugs, then you may have to pay the 100% of the drug. So again, it's important to check your drugs to make sure that all your drugs are covered with the plan you're signing up in. Next. Okay, now we're going to talk about different stages of drug. As if this was not complicated enough, they even made it more complicated by setting up different stages on the prescription drug. Now, if you have a deductible, you have to meet your deductible first. So, if your plan has $480 deductible and the drug is tier 1, which is only $50, and your copay is only $1, but because you have a deductible, you have to pay the full $50 until you meet all of your deductible. So again, important to find out if your plan has a deductible. So after the deductible, let's say you have met the deductible or your plan doesn't have any deductible, January 1st, you start with initial coverage. During initial coverage, you pay your copay and the insurance company pays the rest. In our previous example, If you have a tier 1, you pay $1 copay and insurance company pays $49. So you're in this initial phase, January, February, March, April, you pay your copay and insurance company pays the rest. So you stay in this initial phase until the total cost of your drugs reaches $4,430. Now, the total cost is what you pay and what the insurance company pays. So the total cost in our previous example would be the $50 or the $90. So the total, it gets accumulated, they keep track of it, and during the year, at any time when you reach $4,430, you move to the next phase. The next phase is called coverage gap. Some refer to this as donut hole. So during the coverage gap, you pay 25% for a month of generic drug and 25% for a month of brand drugs. There are some advantage plans that they say, if your drug is tier 1, we cover you during the coverage gap. Some don't. So basically, the coverage gap, you pay 25%. And you stay in the coverage gap until your total out-of-pocket cost reaches $7,050. Now, your total out-of-pocket is different from your total drug cost. The total out-of-pocket is what you pay. Doesn't include what the insurance company pays. So it may take a while until you get to $7,000, but at any time you reach $7,050, then you move to the last phase, which is called catastrophic coverage. In this coverage, if you end up there, you pay $3.95 per month for a month of generic and $9.85 per month for a month of brand, or 5%, whichever is higher. So basically, if you are in initial coverage and in the catastrophic coverage, insurance company helps you. If you fall into the gap, most likely insurance company, they're not covering you and your costs would go up. So this is, let's say, if you have a few expensive drugs and somewhere during the year, you reach $4,430. Let's say in October, when you go and fill your prescription, you realize you're paying your pharmacist. Normally, let's say if you paid $75 for all of your drugs, but then in October, when you go to your pharmacy, he says, well, you have to pay $250 for the same drugs. And you say, well, I just paid $75 last one. How come I have to pay more? It's possibly because you fell into the gap. Now your drugs is costing you more. So there is a message here. The message is try to keep your drugs in tier 1 and tier 2 generic, because not only it's going to cost you less as far as your copay, it also, because there are cheaper drugs, most likely you may not reach $4,430. Therefore, you don't need to worry about the coverage gap. So you just stay in the initial coverage. But if you do have expensive drugs and you cannot control it and you fall into the gap, then you have to see what your plan offers and your costs will go up. Any question?
There is one question. Again, I will leave that at the end. I don't see any related question so far.
Okay, good. So we move on, next slide. These are some terminology. The pharmacy network is the pharmacy that is offered through your plan, whether it's a standalone drug or whether it's part of your Advantage plan. So they recommend if you go to their network pharmacy, you get a cheaper pricing. But generally, my recommendation is shop around, because some plan may say the pharmacy is CVS, but you may get it cheaper if you go to Costco. You need to do your own homework. A drug formulary is the list of your drugs. When you sign up for a plan, you're going to get a list of drugs that are covered under the plan. The drugs are listed alphabetically, and usually after the name of the drug, you see a T and a number. That's for tier. So that tells you what tier it is. And based on the list of your drug costs, you can determine how much the drug is going to cost you. The tier formulary, again, is that we talked about the tier with on your formulary. It's going to have a T and a number. It tells you what tier it is. A step therapy is the plan would generally wants you to at least try a generic drug before you jump into a brand drug. But if for some reason your doctor thinks the generic doesn't work for you and you have to get the brand drugs, then your doctor can write to the plan and request the plan to approve it. And once the plan approves it, then you can do a brand drug. Quantity limit. Generally, drugs are recommended by the pharmaceutical company that you take 1 a day, 2 a day, 3 a day. If your doctor thinks you need to take a different dosage, then he can request the plan and say how many you have to take and get approval. Prior authorization, again, is from your doctor writes to the plan to get authorization for any variation that you may have. Generally, when the doctor sends your request to the insurance company, they review it and approve it within 72 hours. Next. Okay, now let's see if there's any questions here.
Let's see. How about medical devices? Are they covered under Part D? Medical device like CPAP machine?
Generally, your CPAP would fall. It could be part of your plan, or it could be depending what your plan covers. So it's not a drug; it's the equipment. So you have to see what your plan covers it. If this is important to you, you have to make sure you sign up for a plan that has coverage for that item.
Thank you. Any other questions from participants? If not, we'll continue the presentation.
Okay, so the last slide is extra help with prescription drug. So obviously, if you qualify for Medi-Cal, Medi-Cal helps you with the cost of your medical, hospitals, and drugs. But some people, their income may be higher than the Medi-Cal threshold, but they still don't make a lot. So this extra help with prescription drug is another level to Medicare to look at your income situation and see if you qualify for help with your drugs. So if your individual income is $19,320 or joint income is $26,130, then you may qualify for extra help. And if your resources for individual is $14,790 and for joint is $29,520, then you qualify for extra help. Now, the resources are your bank account, your stocks, your bonds, your cash, but it does not include your car and one car and one residence. So if you qualify for what they extra help, then your coverage gap, the donut hole, if you fall into the donut hole, that would be eliminated. and your deductible it would be eliminated. And then you also get help with the portion of your premium. Now, keep in mind, if you qualify for low income, the extra help, you also qualify for a special enrollment. So that means anytime during the year, if you want to change your plan, you can change it. So if anybody is interested to do that, you can either go to medicare.gov and in the search put LIS for low income subsidy, and it tells you what the requirement is, where the application is. If in doubt, go ahead and fill the application and send it to Medicare and see if you get approved. If you have difficulty with doing that, let me know. I can get the application to you so you can apply for it. Okay, so next slide. Finally, this is my business card. So I'm licensed in the state of California. If you have any questions, please don't be shy to give me a call. There is no cost to you to talk to me. It doesn't matter how many times, there is no charge to you. If you decide you sign up for a plan, the company you're signing up with would compensate me. So you don't pay me anything. And when you apply for a plan, whether you go through me or you go through yourself, it would be the same cost and premium.
Thank you, Zara, for the